Trinity, you're here with us today because you are having some symptoms. Is that fair?
Yes.
And these symptoms have been affecting you for how long?
Since I was about 16.
Okay. And you're how old now?
23, almost 24.
Okay. Have you seen any other dentists or doctors in relation to these different symptoms?
Yeah, I've seen 2 orthodontists and 1 general dentist. And the orthodontist recommended a bite plate Holly. And I gave that a shot for a couple months, but I didn't notice any positive change, so I discontinued wearing it. And then my general dentist would refer me back to ortho and tell me to see what they have to recommend, and it was just this continuous cycle.
Did you have ortho twice?
I did, and neither of the times did they touch my jaw, or did I wear rubber bands. They just focus on straightening.
Okay. If you were to quantify your pain intensity from 1 to 10, a bad day, where is that? 1 being nothing, 10 being worst pain ever. Where do you kind of fall on a bad day?
On a bad day, it'd be 7 to 8.
Okay. Walk me through your symptoms. Let's go over the top 5 things that are really ailing you.
I think my most common symptom is tightness and soreness in my left jaw joint. And then it does happen on my right, just not as severe. And then I get a lot of headaches on the right side of my head and pain right on behind my right eye. It's not often that it travels to the left side, except when I have full-blown migraines. That's always on the left side, never on the right side.
Have you had migraines before the ortho?
Maybe 1 as a small child.
What about any neck tension or lack of range of motion?
Yeah, within the last year, I'd say I've been having a lot more neck issues and feeling like I need to stretch it and pop it. Recently, I feel like it's traveled down to my shoulders, and I've been able to acknowledge that kind of separation.
The shoulder neck issue, is that right side, left side, both sides?
Both sides, yeah.
Okay, all right. And then what about any inner ear?
I have had ear issues for probably about 2-3 years, and every time that it acts up, I do see my primary care, and they're like, oh, they take a look, everything looks fine, maybe some drainage, but we're not sure what's going on. And the pain it starts in my ear and kind of travels down my neck here.
And then lastly, you have a number of eye symptoms that are listed. What do you notice about that?
The sensitive to sunlight has gotten more intense within the last year. And of course I do have blue eyes, so they're naturally sensitive, but I can notice a difference. The eye muscle twitching happens just on my left eye, randomly here and there, and problems tracking while reading.
Do you have any questions regarding anything that we're doing today?
I don't think so. I've had some time to sit with this and educate myself on YouTube and your website.
Okay. I'm going to kind of take you through a run-of-the-mill type appointment that we have. We're going to be hooking you up with the facial EMGs to kind of monitor what the muscles are doing, because I think that's where a lot of the muscle tension is probably where some of these headaches are coming from. And then we're going to be using the T-Scan bite computer to just kind of analyze how your teeth come together. And I suspect that you keep pointing to the left side, that there's some anomaly on the left side. So that could be a bite force discrepancy, or you could have a long disclusion time to the left, or you could have both.
Okay.
Right? And so then we're going to come around and I'll kind of walk you through what my findings are, and then we'll go about correcting it. And correcting it's quick. Nobody gets numb for it. Takes me probably about 12-15 minutes.
Wow.
It's really quick. And then we'll kind of reevaluate how you feel afterward. Trinity, you're back with us again today, just to do a post-op and see how things are going, what's different, what's the same, and why don't you just take me through what you experienced over the last, it's probably been a month.
Yeah. The biggest thing I've noticed is at the end of my workday, I'm not having the neck and shoulder tension, and my jaw's not feeling exhausted by the end of the day from just talking. And I notice, like, when I eat dinner, that I'm not having that exhaustion in my jaw. And I've noticed that my popping and the noises my jaw makes have gotten a lot better. I still have occasional popping.
That's probably going to be around for probably 4 to 6 months.
Okay.
And you're young. That's one good thing going for you. But a lot of that gets quiet over a period of time. The symptoms may take 3, 4, 6 months, but it could be 18 months for the joints, because the joints, we really can't stabilize that joint because you've got to talk.
Right.
You still have to eat.
Right.
These are some of the limitations of any therapy for TMD, but just to kind of wrap your head around that.
Yeah, and I've also noticed my ear symptoms of, like, feeling clogged and itchy has improved a lot. It's to the point where I'm like, I think I did instinctively am, like, messing with my ears, but I'm like, why am I doing that? I'm not having that sensation. That's been something I don't think I've acknowledged that fully, but that's nice to acknowledge.
Well, good. So one of the things that you mentioned on the first video was pizza crust, unlike pizza crust. So I wanted to ask you specifically, since you brought that up, have you had pizza in the last 3 or 4 weeks?
Yes. Weekly.
Okay.
And it's been great. I noticed when I'd get to the crust point, and that's my favorite part, when I would be eating that, it would get to the point where I wouldn't want to finish eating or finish chewing because my jaw would be so painful and exhausted. But now I can eat the whole thing, and I'm feeling great.
All right. Well, good. So I appreciate you just letting me visit back with you, because I know you take a lot of calls and you hear people speaking with these crazy symptoms, like, well, how can all this be related, and now you're living it, right? So I'm glad that you're getting some relief. I'm probably going to post this video. That doesn't mean we're done, but we're going to continue to follow you just like we do everybody else. But once we have so many boxes checked, that you're kind of on the other side of this, and we just need to maintain.
Yeah. And I already feel like I am able to explain the treatment to patients in a whole different way now.
For sure.
And it's really nice.
All right.
I appreciate it.
Any questions for me?
No.
All right. Well, I'm going to get Miss Ashley, and we're going to get you finished up.
All right.
All right.